Hello friends, today let's discuss the topic effects and uses of therapeutic modalities in rehabilitation, cold therapy, hot moist, infrared, contrast bath and wax bath therapy. Let's start with the introduction. Rehabilitation is the utilization of the existing capabilities of the differently able person by the combined and coordinated use of medical, social, educational, and vocational measures to the optimum level of functional ability. To complete a proper rehabilitation program, certain electrotherapy modalities are employed. Electrotherapy can be defined as the treatment of patient by electrical means. By implication, this means that electrical forces are applied to the body, bringing about physiological changes for therapeutic purpose. However, in addition to these external forces, electrical charges are generated within the body by normal physiological process. Between these two sets of electrical forces, there will be interaction between the changes that occurs as a result of the body response to the injury and any applied therapeutic agent. First, cold therapy. Cold therapy or cryotherapy refers to the use of local and general body cooling for the therapeutic purpose. This can be classified into first, local effects, and second one is general effect. So let's start with the local effect. Local effects of cold therapy are first, cutaneous blood vessels, second, muscle blood flow, third, on metabolic rate, fourth, the peripheral nervous system, and fifth one is on the motor system. And first one is on the cutaneous blood vessels. There is immediate vasoconstriction of cutaneous blood vessels shown by the blanching that occurs. This restricts the blood flow in the skin so that heat loss is minimized. The speed with which this vasoconstriction occurs indicates that it is a reflex in the autonomic nervous system, which is triggered by stimulation of the thermal receptors in the skin. After some minutes, the vasoconstriction may give way to a marked vasodilatation, which itself may last some 15 minutes before being replaced by another episode of vasoconstriction. This alternation of constriction and dilatation is called Lewis-Hunting reaction by Lewis in 1930. It serves to protect the tissue from damage due to prolonged cooling and ischemia. And second one is on the muscle blood flow. This applied to the skin only, a region involved in thermal regulation. The response of muscle flow to cooling is less dramatic. It seems likely that cooling provokes vasoconstriction in all vascular smooth muscles, and the increased viscosity certainly reduces the blood flow. And the third one is on metabolic rate. Cooling affects the living tissue and reduces its metabolic rate due to the reduced oxygen uptake. Cold-induced vasodilatation is distinguished from that of heating due to its pinkness because it contains less reduced hemoglobin. Thus, cooling does not benefit the healing process. And the fourth one is the peripheral nervous system. Cold applied to the skin provides a strong sensory stimulation by stimulating the cold receptors. This may be used therapeutically in the suppression of pain and treatment of hypertonicity. If the cold is sufficiently intense, it reduces the conduction velocity of peripheral nerves. And the fifth one is on the motor system. Muscle strength of motor skills are diminished by cooling, probably because of its effect on viscosity and metabolic rate. The next topic is general effects of cooling. Cooling applied to the skin immediately stimulates the cold receptors, which are more numerous than heat receptors in any given area of skin. The hypothalamus acts as a thermostat to maintain core temperature. The posterior hypothalamus is concerned with the response to body cooling being affected by the nervous input from the skin as well as the blood temperature. To conserve heat, it is responded by cutaneous vasoconstriction and by increasing blood flow to the skin through vasodilatation. And the next topic is therapeutic uses of cold therapy. First one is acute injuries. Cold is widely used in the treatment of recent injuries. When bleeding occurs on the skin surface, cold serves to promote immediate vasoconstriction and makes the blood more viscid, helps to reduce bleeding. Pain. Pain can be alleviated by the application of cold in several ways. First one, by reducing edema, and second one, by decreasing release of pain-inducing irritants, and third one is by reducing the velocity and number of impulse. And third one we can use in the muscle spasm. Application of cold would reduce muscle spasm and so allow increasing range of motion. And the fourth one we can use in the muscle spasticity. Cooling diminishes gamma motor neuron activity and diminishing the muscle spindle discharge and so reduce spasticity. And the fifth one is muscle strength. Cooling the skin surface can lead to increase the strength of the underlying muscles. And sixth one is chronic inflammatory condition. Cold may be beneficial in chronic inflammatory condition by the virtue of its pain-relieving effect. And seventh one is chronic edema and joint effusion. The application of ice and compression are used for the treatment of chronic edema and joint effusion. And here comes the method of applying cold therapy. Cold therapy can be applied in terms of first one, local immersion, second one, cold packs, third one, ice towels, fourth one, ice massage, fifth one, cold compression unit, and last one is evaporating spray. The next topic, hot moist therapy. Hot moist therapy refers to the application of hot water to the extremity by dip and wrapping method. It can be done with hydrocollateral packs. These hydrocollateral packs consist of a silica gel in a cotton fabric container. This gel will absorb large quantity of water if it is hot, provides a considerable store of heat energy. The gel is contained in a set of separated fabric pockets so that the whole pack is flexible and the gel is confined. They are heated by being placed in a special tank of water warm to 70 to 80 degrees Celsius by an electric heater controlled by a thermostat. It takes about 2 hours to become fully heated from cold but less when reheated. And here comes the method of application of hot moist therapy. The hot packs are wrapped in towel about 4 to 6 layers before being applied to the part. This provides thermal insulation and avoids burn to the part. For the skin to reach its maximum temperature, it takes about 8 minutes. As the temperature of the pack decreases, the layer of the towel can be decreased to achieve the required heat. And here comes the infrared rays. Infrared rays are electromagnetic waves with wavelength of 750 nanometer to 1 millimeter. Any hot bodies emit infrared rays such as the sun, gas fire, coal fire, electric fire, etc. Here comes the therapeutic infrared lamps. There are two types of infrared generator. The first one is non-luminous generator and second one is luminous generator. Treatment with a luminous generator is often referred to as radiant heat. The term infrared generally applies to the radiation from non-luminous source. And here comes the non-luminous generator. A simple type of element for producing infrared consists of a coil of wire wound on a cylinder of some insulating material such as fire clay, like the element of a radiant electric fire. An electric current passes through the wire and infrared are emitted from the hot wire, which is heated by conduction. And here comes the luminous generator. The rays emitted from the luminous generator are produced by one or more incandescent lamps. The lamp consists of a wire filament enclosed in a glass tube which may be evacuated or may contain an inert gas at low pressure. The filament is a coil of fine wire and is usually made of tungsten, and this material tolerates repeated heating and cooling. And here comes the application of infrared rays. At the commencement of the exposure, the intensity of radiation should be low, but after 5 to 10 minutes, when vasodilatation has taken place and increased blood flow has become established, the strength of the radiation may be increased. This can be achieved by moving the lamp nearer to the patient or by adjusting the variable resistance. At the end of the exposure, the skin should be red. Following extensive irradiation, the patient should not rise suddenly from the treatment position. And here comes the therapeutic uses of infrared. First, relief of pain. When the heating is mild, the relief of pain is probably due to the sedative effect on the superficial sensory nerve endings. Stronger heating stimulates the superficial sensory nerve endings and block the pain pathway. Muscle relaxation. Muscle relax when the tissues are warm, and the relief of pain also facilitates relaxation. Infrared irradiation is thus of value in helping to achieve muscular relaxation and for relief of muscle spasm associated with injury or inflammation. And third one, increased blood supply. This effect is mostly marked in the superficial tissue, and it may be used in the treatment of superficial wounds and infection. And the fourth one is promotes tissue flexibility and reduce stiffness. And fifth one is treat some skin condition. The next topic comes dangers with infrared treatment. The first danger is burns. Second, skin irritation. Third, lower blood pressure. Fourth one, eye damage and dehydration. And here comes the contraindication of the infrared therapy. The infrared therapy should not be used in case of impaired cutaneous thermal sensation. Second one, defective arterial cutaneous circulation. Third one, patient whose level of consciousness is markedly lowered by drug or diseases. And fourth one, acute skin condition, for example, dermatitis. And the fifth one, skin damage due to deep X-ray therapy. And next one, defective blood pressure regulation. And next is acute febrile illness. And last is tumors of the skin. And here comes the next topic, contrast bath. Contrast bath involves alternate immersion in hot and cold water, producing marked hyperemia of the skin. Such treatment will cause considerable sensory stimulation as the cutaneous hot and cold receptors are alternately activated. This stimulation is relatively vigorous because each time neural accommodation starts to occur, the temperature stimulation is reversed. Method of application. Two suitably sized baths are filled, the hot at 40 to 45 degrees Celsius and the cold at 15 to 20 degrees Celsius. It is usual to start and finish with immersion in the hot water. The period of immersion in the hot water is longer, 3 to 4 minutes, while immersion in cold is kept to 1 minute. This cycle is repeated for 3 to 4 times so that the whole treatment lasts anything from 20 to 25 minutes. During the treatment, the hot water will cool and the cold water will be warm, partly due to the transfer of the warm and cold limbs from one bath to another. It is therefore necessary to monitor the temperature with a thermometer. Next topic is therapeutic uses of contrast bath. The first one is to relieve pain, and the second one is helps to reduce local edema. And the next topic comes wax bath therapy. The paraffin wax melts at around 54 degrees Celsius, but this point can be lowered by addition of mineral oil such as liquid paraffin. Most wax baths are kept at temperature between 42 to 52 degrees Celsius, often at a higher range for hand treatment and rather lower for the feet. The wax is maintained molten in stainless steel or enamel bath, which are electrically heated. Temperature is kept constant by the thermostat. And the next topic is method of application of wax bath. The part to be treated must be clean and free from cuts, rashes or infection. Position the patient according to the part to be treated and instruct the patient to dip the part in and out of the bath until a thick coat of wax sets on the skin. This usually takes 4 to 6 immersions. Wax gives off heat slowly due to its low thermal conductivity, but after removal from the bath, the part cools quickly. In order to retain the heat, wrap the part in a layer of plastic sheet or a towel. Treatment is usually given for about 20 minutes. After this time, remove the towel and the wax. And here comes the effects and indications of wax bath. Circulatory effect. There is a stimulation of superficial capillaries and arterioles, causing local hyperemia and reflex vasodilatation. And next is effect on sensory nerve. Mild heating appears to have a sedation effect on the sensory nerve endings. As wax can be molded around the contour of the hand and feet, it is of value in the treating rheumatoid arthritis or degenerative joint diseases and reducing pain and muscle spasm. Effects on the skin. The skin becomes moist and soft following application, which can therefore help to soften adhesion and scar in the skin prior to mobilization and stretching procedure. Contraindication of wax bath. This wax bath should not be used in case of open wound, allergic rashes, acute skin condition, for example, acute dermatitis. Fourth one is defective arterial blood supply, for example, deep vein thrombosis and varicose vein. And the fifth one is impaired skin sensation. The conclusion of today's topic. From the above discussion, it is well known that electrotherapy modalities are of big help in the treatment of patients with different problems. If the modalities are well understood, there can be a wide variation in acceptable technique and treatment within the confines of safe and effective practice.